Welcome to Unlearning Ignorance, a podcast where once a month we discuss a commonly divisive issue and attempt to fairly represent multiple perspectives. We are not experts, nor are we neutral. Our goal is to show an accurate understanding of conflicting sides, in hopes that it will foster civil conversations with an attitude of always learning. But we also want the show to represent you. So every month we will have a response episode where we highlight your comments, emails, tweets, and voicemails, telling us what we got terribly right, incredibly wrong, or something in between. Thanks for listening to this month's episode, where we bring together Vox Populi, the voice of the people.
Hey, Ethan.
Well, hello, Chase.
It's good to see you in person.
Yeah.
Again.
Good to be in person, be a person.
Usually from different states, but occasionally actually recording face to face.
It's good to see somebody just in person, face to face. You don't get a lot of that right now.
We and obviously we're doing a kind of a COVID/quarantine based episode, and we've been going back and forth for a few months now on when to do this, if to do this, and really what the focus would be. And we're coming from different contexts. Obviously, I'm seeing it things unravel in the Nashville area, where it's highly urban, and then that area is getting hit more than most areas of Tennessee. And then you're in
DFW,
the Fort Worth, Dallas area of Texas,
which did an attempt to lax and kind of reopen, not so recently.
Yeah.
Or like a month or so ago. And so it's been like weird reverting back, like a kind of a tease. Where
right.
Oh, now we get to go to places. Now
we had the same thing we had like 4 phases of reopening. We got to phase 3, then spikes hit, so we rolled back to phase 2. And so for the purpose of this podcast, it's like what exactly are we going to talk about in relation to the quarantine? Because we thought about focusing on masks, mask versus anti-masker. There's kind of the topic of is this all some big conspiracy? Is the virus even real? That's almost way too small of a focus, because it's so easy to verify that it's a real virus that people are really contracting, that I don't think that's really right for the purposes of this.
Yeah, I mean, I have personal friends who've had weird symptoms like flu/losing taste.
Yeah.
Like that's not something you see with most of the common
cold
or
right.
flu. It's a new, different virus for sure.
Yeah. But as always, our main purpose with this show is to promote conversation, to promote understanding and empathy from different sides of the line, from different perspectives on our culture's most divisive issues. And you came up with I think the best kind of main focus around this issue. So why don't you explain kind of what our main kind of pro-con different sides is going to be for this discussion?
So it was very kind of difficult to draw the lines, because everything was so fluid. Like new information was coming out, and people seemingly from like political sides to religious sides were taking vastly different stances, and there wasn't any clear divide. But I think we've had enough time where I kind of see there's the trusting of the majority of authorities, or at least the governmental authorities that have been put in place. And there's those that are untrusting of the establishment and looking towards alternative analysis of the situation. An authority I could definitely think of is the WHO, the World Health Organization. And so that they're kind of people who either reject their narrative, I would say, or like are following as strictly as they can with their recommendations.
Right. So as we dig into kind of trusting the establishment or distrusting the establishment, meant, accepting the narrative that we're getting from our government, our leaders, WHO, CDC, or kind of distrusting it and thinking maybe we shouldn't really be believing everything that we're hearing. And so we wanted to make sure not only we did plenty of research, we'll be, quoting sources and looking at specific, or at least mentioning specific articles during this conversation, but we've also got a guest with us. It is not just the two of us. So would you like to introduce our number 3?
This is Mr. Austin Burnett. He is a nurse practitioner. Welcome to the podcast, Austin.
Hi, it's good to be here. Oh man, you went full podcaster mode real quick.
I feel like you've listened to a podcast before, and that's what everyone always says, their first line. So what is your kind of place in this story? And on a short view, before we get into more later, your firsthand experience with COVID-19.
So I'm a nurse practitioner in a family practice setting, so I take care of mostly adults, but I do take care of some children age like 5 and up. And so most of the ranges that I'm going to be seeing are going to be in the 20s to early 60s. In our office, we stopped seeing sick patients in person, and we started seeing sick patients via Skype or Zoom call.
When about did y'all do that?
We started doing that in March, whenever they did the shutdown. And so we still see well checks, which can turn into COVID patients. But all of our sick patients we're seeing via Zoom.
About how many patients have you seen that have tested positive, or how versus how many have you recommended get tested for COVID?
We've had probably around 40 to 60 positives. And I can't even give you a number on how many we've tested. Probably maybe double that, maybe. So maybe around 100.
So 1 in 3, is my math right? Yeah, 1 in 3, about 1 in 3 that you recommend to get tested, test positive based on their symptoms. And
yes, it varies. We'll have a week where I'll test 10 people and 8 out of the 10 test positive. And I'll have a week where I'll test 12 people and 2 of them test positive. So it just depends on the week and varies on the patient.
Do you feel like you can kind of feel a trend general associated with the spike in cases, that like it was slow at first and it's kind of rising even though week to week, just talking overall trend, that you are seeing more and more positive cases since the beginning of it, I would say?
I would say the first, there were a lot more negatives, and now we see more positives. So yes, I would say we go along with the trends. I would say probably 3 weeks ago, we tested quite a few people, probably 20, and not very many of them came back positive. And then over the past 2 weeks, our positives are at least 50% or more.
Everything is very new here. We're in a place where even for countries where the line is flattened, theoretically spikes could happen again. There could be a second wave. There are so many unknowns, and we're trying to understand what's going on, when sometimes the science, or what's being reported as science, or what's being reported as trustworthy information, sometimes isn't true or isn't as trustworthy as we think. When we look at the way that like the CDC can kind of flip-flop on some things, the way that we hear one thing one month and it changes the next month, the way that we're still just discovering new information, it gives people a kind of place to, like we said earlier, trust or not trust the establishment. And there's basically enough information out there that is valid or seems valid, that whatever stance someone wants to take, they can go and find something online that validates their stance. And so we have people on these divisive sides that have support for whatever stance they choose to take on how serious the virus is, if our government is handling it well, what we should actually be doing as citizens about it, whether the government has any right to be, forcing us to wear masks or forcing us to be quarantined, and so on and so forth. So it might be hard to stay on specific topics, but I think we're going to be drilling into just specific ideas and questions around those ideas as we try to create a conversation to engage these different sides and whether or not we trust that, which of course we're coming from presenting information, presenting news articles, presenting studies in scientific journals, not necessarily talking from our own perspectives on the issue. So,
But I mean, with every topic we try to keep our own perspectives out of it, but with this one, I believe it's just difficult because
I think
there's a lot of conflicting information. I have faith in you too.
Thank you.
Not so much in myself. So, what do masks do?
So the general gist of what a mask does is when someone's wearing a mask and they're wearing it covering their nose and covering their mouth, whenever they talk, whenever they cough, whenever they sneeze, whenever they're breathing, the mask is blocking some particles from coming out. So there's still air that's going in and out of a cloth mask or just a regular surgical mask that people wear. And so it's blocking a significant portion of droplets that are coming out.
Droplets, yeah. And that's generally what I've heard. And I've seen some pushback in that some of them think that because it's catching droplets, that it's creating a I think described as a microbiome of just growing bacteria. And is that something that you think can happen after wearing it for a mask for a full day? And say you're in an office, an open space office where you have to wear a mask because you're close vicinity to everybody. So an 8-hour work day.
I think what you're asking me is there a risk of me getting some kind of infection, like a bacterial infection, because I'm wearing a mask for 8 hours?
Yeah.
I would say no.
When you answer that question, are you referring to any type of mask or are you referring to the medical masks that you wear as a nurse practitioner?
I would say any mask. Most masks, even masks that are worn in a medical facility, don't have clothing or some types of materials have antibiotic qualities, or they're meant to kill certain things. Most masks, even in medical practices, they don't have those type of qualities to them.
Yeah. So there was a point where Dr. Tony Fauci, who's become pretty famous throughout this year, actually told the public not to wear masks. So the reason for this was saving the medical masks for the medical professionals. We were the narrative around the public not wearing them was so that production would not run out for the people who needed them most, the people who were intentionally around sick people, contracted people, and so it was later on that this idea of cloth masks came up, and I don't think anyone is saying that the medical masks are a problem. But there is a strong narrative of people saying that cloth masks are a problem, that, people have been told that they can just make them at home with whatever household materials they have, that whereas a medical mask might have antibiotic properties, or they're also made with very special filters. I've heard it explained, I think maybe even by Tony Fauci, that it's like creating a maze that the bacteria gets lost in, as if they trying to go through the filters they can't get all the way through. But the cloth masks, on the other hand, it's much easier for the droplets to get through, the particles to get through, that if a medical mask is getting about 95% of bacterial particles, the cloth masks might only be getting 50%. And then when you consider the fact that it's also going to be retaining moisture pretty well, and people might not have very great habits of cleaning them, then you actually might be carrying contagions around with you rather than really protecting yourself from them.
Yeah, so if you're wearing a mask and you're breathing and you have a disease, if you have the disease, you already have it. And so the inside of your mask is going to have whatever droplets that carry whatever you have in it. The other side of that, so if I have a disease, an upper respiratory infection, and I'm wearing a mask, that's keeping some of what I'm breathing from getting on anybody else.
Mm-hmm.
The other side of that is if Ethan has an upper respiratory infection or has COVID, and I'm wearing a mask and his droplets get on me, but they get on the mask, then that means that my mask is now dirty. And so when I touch the outside of my mask, whether I've worn it for 10 minutes or wherever I've worn it for a whole day, if he breathed on me the first 5 minutes that I had that mask on, then in essence, the outside of my mask is contaminated by whatever is coming from some other person.
So if you were to say take it on and off after coming into contact with that infected person, that could essentially be spreading it to you and almost nullifying the effects of the mask, because you took it off, you put it back on, you probably touched your face.
It's still probably doing some good because some of those germs are going to die.
Yeah.
Because
how long would you say that usually takes COVID-19 to die on surfaces?
There's lots of different research, and it depends on the surface. It depends on if it's moist. It depends on if it's something that's letting it soak in or not. And so it just depends. I would say if you're wearing a mask and somebody breathed on it, or you got germs from somebody that had COVID, I would say that I wouldn't touch the outside of the mask.
Yeah. So I do have a study here. It was an Australian, New Zealand clinical trial that concluded on a study of cloth masks that the results caution against the use of them. That the trial was basically in a hospital where they kind of separated out, I think, like 3 wards, with one using medical masks, one using cloth masks, and one that was a control group of just usual hospital practice. And the cloth mask ended up in the worst condition. That the cloth mask, the ward where everyone was wearing cloth masks ended up with the greatest infections, which suggests that if we're not using medical masks, we might be better off without them. However, just to contest my own point, which is not usual practice but just with the amount of research that we've done, I think I'd be remiss not to bring this up. I think if that's the anti-cloth mask position from people who are kind of against them in general, that from a more pro-cloth mask position, which would go more with what you were saying, Austin, that you can't wear a mask and then forget all of the other practices that you should have. That if you're wearing your cloth mask, but then not washing your hands well, not social distancing, getting close with other people, touching your face, removing your mask, to talk to people, doing things like that, then your mask will become a problem because you think it's putting in more work than it actually is. And you're losing the measures that you should be taking because you think, oh, I'm wearing my mask, I'll be fine. Which is a problem that we've seen in a lot of issues, like kind of airports or offices where they've put up like thermal detectors that are kind of measuring people for fevers as they come to the building. And you pass through, you're screened and you're good. And so you think everyone in this building has been screened, so none of us are sick, so we can just act like normal. Well, those screenings don't really do much except for give you false security that then make you think that you can just live like normal, and then you'll actually be getting each other sick.
Security theater, yeah.
Yeah.
And it also doesn't detect people who are asymptomatic. And I think this is the first time I've ever heard of a very, very infectious disease where people can have it and spread it and never get sick. It's a total mind bender that you're sick, but you're not sick, and you can get others sick, but not know you got others sick. And so that security theater, you're right, can actually endanger people into a false sense of security.
Yeah, I'd agree with all those statements.
Have you encountered any sort of shortage with masks? Do you think we're at a point where the public should probably consider using medical masks rather than cloth masks?
In our practice, there is a shortage. So in N95 mask, which is the big one that they tout as being the best, our office has not been able to get since March.
Wow.
Just recently in the last month, starting in March, we couldn't get N95 mask and we couldn't get a surgical mask. And so just within the last 3 weeks, our practice has been able to get boxes of surgical masks, but we're still unable to get N95 masks.
It was my understanding that a lot of the suppliers, at least at the beginning of the crisis, for masks were in China. And so because of that whole travel ban, that really limited or the fact that maybe the Chinese government were kind of keeping the masks for themselves. That kind of also limited the supply, not just runs on Amazon or the normal distributions for masks. Is that something you saw at the beginning of the crisis too, or is that more of a recent shortage of masks?
I think there's some of that. I think definitely the supply, the demand went up significantly. In our office, we probably went through a box of masks, 50 masks. We probably went through that over a 3-year period, before all this started.
Oh, wow.
And now when we get a box of 50 masks, we may go through that in a week or less. And so, our need for them significantly increased, and everybody's need for them significantly increased. And so the demand was much more than the supply.
Did you have to switch suppliers to get masks fulfilled at any point, or is it the same fulfillment you go through?
So we have 2 major distributors that we've used, and we haven't been able to get masks from them since the start. We're now able to get masks through the county that we're in. And the county, now the county government and the city government has been able to give us masks.
That's good. Well, so I think there is at least one other big question that we need to ask before we move on from masks.
Okay.
Should the government be forcing me to wear them? Is it an infringement upon my rights to be required to wear them when I'm out in public?
See, when you're out, I think it's case by case, because when you enter a government building, nobody disagrees that the government can require you to wear a shirt or shoes kind of thing. And so...
All right, can the government require me not to go nude in public? Sure. Yeah.
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 It's I think it's a logical extension of that. Saying outside in public places, I think, is a different thing than inside buildings. Not continue with the nude allergy. I don't know the word.
Nude analogy.
Analogy? Yeah. Nude analogy.
The nude analogy.
Out in public. But in public buildings, I could see that. It's interesting them forcing health codes, because they do enforce health codes on restaurants and businesses to wear masks. And so it seems like a logical extension for them to force businesses this is a health violation for your customers not to wear clothes, wear masks. The outside public places like parks, I kind of have a problem with, because there's plenty of wind, and masks aren't as effective when it's not in an enclosed place. But as far as inside buildings and health regulations, it's pretty clear that they have that authority to enforce that. At least we've given it to them over the years.
Yeah, I'm not interested, at least for this podcast, in even really considering the issue of private businesses. You know, like every business has a right to serve whomever they want to serve, to not do business with you on their own terms. But yeah, it's the in public thing that I think is the interesting question.
Well, I mean, the government is forcing the private businesses to have this policy. So,
well, sure, that
and so
that has become the case recently.
They're considering businesses as public.
Yeah.
So I don't.
that is interesting.
Yeah, I don't see much of a difference between them enforcing a policy in their own buildings or out in the parks versus them enforcing it on businesses.
Yeah.
Or the business will get fined.
Interesting. Okay. Yeah. I didn't piece that together. I've been thinking about companies like Starbucks that were kind of ahead of the game in requiring the face coverings prior to
just shutting
more
down
recent mandate.
full in store.
There's fear about what sort of precedents we're setting right now. I mean, obviously we are in unprecedented times, but when government has that sort of power over businesses, when government has that sort of power over people, what are we setting up that can be potentially abused later on in future things that the government forces us to do? You know, I think something that a lot of people are worried about, not to get too deep into like the anti-vaxxer position, but is every single American going to be forced to get a vaccine once it's ready?
Well, I mean, currently they force people who go to daycares or, for the most part, public schools to get it. So participating in public life, they've done that historically. And if you don't want the government to do it, I think you have to vote in officials who will stop, who will write laws to do it. So we have given a lot of authority to the government, and including on vaccines, to enforce those policies. You don't have to do it. If you homeschool, you don't go out in the public.
Well, sure, but like that could change. You know, if right now vaccines are required for, like you said, public school students, and what if that gets expanded to all people?
So I think that's where you're crossing the constitutional line. It's when you're going to somebody who's in their own home, not utilizing public services, going too much out in the public, that you're now crossing the authoritarian line of saying, okay, because you're physically in this country, you have to do that.
Well, and is there anyone that uses no public services whatsoever? Like, do you think that's just a hypothetical person? Someone who's, you know,
physically in public services, not like public water or services coming to your property, but being out in public. I mean, the Amish do it, pretty sure.
Maybe.
They have self-sufficient communities.
Yeah.
In the modern world, it is rare, but it's, if you don't want to be vaccinated, you don't want to wear masks, you go to those communities. The Orthodox Jew community in, I think in New York, not big fans of vaccines, so they don't get vaccinated. They get the religious exemption.
Yeah.
I don't know. I think most of them are either private or homeschooled. Don't quote me on that though.
I love quoting you on things. I don't know. Do you have anything to add on that kind of question of the issue of mask and rights, or whether it's a mask or whether it's a rights
infringement on your rights?
Yeah.
I think the analogy for me is seatbelts. Is it legal for the government to make you wear a seatbelt? Because they say that if you wear a seatbelt, you're less likely to be injured or killed in a car accident. And so I think that the argument there is the people that don't want to wear masks are also more likely to be on the side of, I don't have to wear my seatbelt because they can't tell me to wear a seatbelt. But then it goes to, am I in a public place or am I in a private place? And does the government have to have the right to tell me what to do in my own home or my own car or my own business.
I think seatbelts is another good analogy for another reason, in that masks, like theoretically, can be a cause for other health risks, just like seatbelts can be a danger if you wore it, say, and you crashed into a lake and you were trapped in your car, you can't get your seatbelt undone. That is a much smaller risk of death than being in the majority of car crashes not wearing a seatbelt.
Right.
And so both have risks, but you have to weigh the overwhelming risk of catching COVID-19 or dying in a head-on car collision without a seatbelt versus getting trapped under a lake with your seatbelt not coming off.
Right. I think that actually is a really good analogy, because like there is science, there's clinical trials that say, wearing the mask can actually make you worse off. And the same, like you said, like there are a few situations where the seatbelt can actually become a burden rather than a help. But clearly, like the bigger issue would be like, wearing your seatbelt incorrectly. Like there are a bunch of wrong ways to wear it, that become more of a risk to your health or completely unhelpful in the way that you can wear your mask incorrectly, or deal with it improperly. That just makes it makes it no good, or potentially makes it more dangerous for you.
There are unsafe ways to wear a seatbelt, and that's why there are laws on child safety seats.
Yeah.
That children up to a certain age, up to a certain weight, have to be rear facing, and not in a child safety seat that's facing forward and things like that. And so there's research that shows, the likelihood of a child being hurt if they're front facing and they're under a certain weight. Again, when we go back to the masks, in studies that I've seen by the National Institute of Health, they've taken studies and they've shown that when worn properly, masks are around 80% effective in preventing upper respiratory type infections.
Mm-hmm.
And when worn in different settings that are not more controlled, like a hospital, they're still effective, but only 40% effective in preventing an upper respiratory infection. So there's not it increases my risk that I've seen in studies. There's only been it decreases the risk, but not as much as if I'm wearing it correctly.
Yes.
This is a minor tangent, but do you possibly think the social acceptance of masks and ubiquity of people wearing masks correctly may curb the flu season coming up right around the corner?
So I've just this last week, I saw statistics in South America, on the other side of the world, where it is flu season. And since they have started wearing masks this year, they've seen the rate of people that are getting the flu decreased in some of those countries, that it's right now flu season. So yes, in other countries and other parts of the world where it's currently flu season, they're seeing a decrease in the amount of people that get the flu, and they're attributing that mostly to people now having to wear masks because of COVID down in different parts of the world.
Mm. And correlating with that would be, there are some countries that we can point to where wearing masks in public was already the norm, where they weren't hit as bad to begin with, and the curve flattened pretty quickly, like May, and has been pretty low ever since.
We've talked about the mask, but you also discussed the cumulative effect of like doing things like washing your hands, and a new term that has been spread is the social distancing. 6 feet. I have never measured 6 feet so much in my life of thinking how many two full steps, which is like one step for me is approximately a yard. It's like, can I get to that person in 2 steps?
Whenever we're breathing, we breathe out droplets, and they go so far and then they drop, or they dissipate in the air. Whenever we cough or we sneeze, or we even sing, those droplets go further. And so the 6-foot rule is based off of guidelines and studies that show after 6 feet, droplets tend to disperse or drop from the air more so at that 6 foot than closer than 6 feet.
There's not really been governmental enforcement. It's more been social and recommendation from CDC. Mm-hmm. And to me, I feel like you don't see as much pushback on the social distancing as masks. It could be because masks are uncomfortable to wear. They're a little hot and there's a bunch of negative downsides. But to me, it also a contributing factor of the lack of pushback on social distancing is the lack of requirement, the lack of like heavy-handed, like you have to do this or you can't go in this restaurant. You have to do this or you can't come and file your taxes, whatever.
Yeah, my theory is that people don't actually like people as much as they said they do. And now they're just getting a beautiful excuse to just like, oh yeah, you can stay away from me. No, I don't want your hugs.
There's more introverts in the world. They were just all closeted.
Yeah.
Because of social norms.
Right.
I think everybody has a bubble, and certain people's bubble is bigger than other people's. Yeah. In certain parts of the world, their bubble is a lot smaller than in America, and there's even parts of
in the South.
Yeah, in the South we have small bubbles. We have in the South we have big bubbles. I need more space in the South.
It's almost like the way that an alligator only grows as big as the lake that it's in. Like, it's like we're given more space now, and we're just enjoying it. You know.
I like space.
I'm mostly joking, but
so I'm going to reject it as the resident extrovert of this podcast. I'm going to reject that because I'm a big fan of hugs. I miss hugs.
Yeah, I like hugs. I like to give me my hug and then get out of my space.
Yeah. Social distancing gets broken all the time behind doors, and I think that's kind of where people get their quick fixes. Like, currently there's gatherings allowable depending on where you live of like up to 10 or up to 25. And when you're around people while you're still suggested to be social distancing, conversations happen all the time. Like, are you hugging? Can we hug? Or is this okay? And I think people are getting like whether you want to class it as extroversion or not, I think people are getting their social fixes. Yeah. And people are, still like, most people have some sort of like familial relationship where it's like, if you get the coronavirus, I'm probably going to get it anyway. So let's go ahead and continue, having our physical contact, whatever that means in the context in which you're interpreting it. But my experience has primarily been, this is doable. This doesn't change life too much. I think if it was some sort of like, if you started having like on a policeman's like utility belt, like a measuring tape, and he actually was coming around and doing 6 feet on people.
They start carrying yardsticks around.
Yeah. And hitting you with it if you're not at the full 6 feet. Yeah, like that would be really problematic. But like we are approaching America's like flu season. It's not a bad thing to have a little physical distance from people, I think. And it's been funny to think about. Coronavirus isn't the only way that you can get sick. All of the other flus and colds and diseases are still out there.
Yeah.
So
pivoting a little back, rewinding the clock a little bit into the past about quarantine. So I saw this as kind of the most controversial. Is the government allowed to tell you can't practice business? Because in Tarrant County, in particular, a judge signed a 2 weeks saying only essential businesses. And of course, the essential business list was fairly long. And
right.
It might just be the circles I travel in, but a lot of people were quote unquote essential, including myself. Can the government tell you can't sell products? You can't have your storefront open? Because that is very unprecedented in my limited experience.
Right. Like, should a business have the ability to say, I'm going to take the risk because I want to still make money and I want to
feed my family?
Right. and I want to let the people who want to shop here also take that risk, because we have customers who want to come. We have business that could be happening right now.
And stay at home orders, these all kind of go together because
Right.
you couldn't travel to non-essential things, not go in a grocery store or work or possibly
Concerts.
medical care. I don't think concerts. There still aren't concerts happening, right?
2020 was a peculiar year in terms of how many concert tickets I had purchased, which I haven't been to any of them. Some of them are really sad. Some of them are getting perpetually rescheduled over and over again. Some of them may never happen again.
So, has the government does the government have the authority to tell you not to sell products, to not do
They
business?
do, obviously. Should they?
I don't know that they do.
Really?
You
think that they're acting out of power that they don't actually have?
I think if somebody were to get a good enough case that they could probably sue, if they could show enough damages to their business, or I think they could probably sue a couple governments and say there's no precedent for this. There's no authority. It came without notice or minimal notice. I believe we had 24 hours maybe in Tarrant County for you got to stay at home and you can't go to any institutions that aren't essential.
Yeah.
I think they would have a strong case. It would go to Supreme Court for sure. Do you see them as having that authority?
I don't think so. None of my research helps me in discussing this particular topic. But
it's hard because we're waffling between governmental authority and social norms and how we interact with people, because all these lines are blurred. So this episode feels very singular in that we're both addressing the political and social and for some reason medical, because we needed a medical expert here. Because medical is very important to everybody now.
Right.
Whereas it could be considered an afterthought for, I would say, a lot of people who are generally healthy in America. But
we are certainly in an age where what the government actually has the power to do, and then what it purports to have the power to do or the right to do, is there's a chasm between that. We have all the time the president being accused of doing things that he's not supposed to be doing, or making executive orders that it doesn't have the right to. We have plenty of cases where you could point to the judicial branch of the government acting legislatively. We have a lot of confusion between what should be in the rights of the states versus in the power of the country government. And so, it's a lot of blurred lines, a lot of different opinions. And I think things should be deferred to states probably more frequently than they are. I think this could get us into a different discussion. But, does a particular understanding of public safety give the government a right to enact public safety laws? I don't know how quickly we want to get into this, but there are a handful of groups who suggest that we should have let the virus run its course in America, that we've actually made things worse by trying to push back on getting some.
you're talking about herd immunity.
I'm talking about herd immunity.
I think Austin might have an opinion on herd immunity.
Hey, if you've got enough time, you can get herd immunity. It takes a lot of time.
What are some of the risks of herd immunity, of attempting herd immunity without all of the measures?
The concern with herd immunity now with COVID-19 is the amount of sick people that get sick enough to need to be in the hospitals, and the concern that if you just don't practice any social distancing, you don't wash your hands, you don't wear a mask, that enough people will get sick, that a certain percentage of those people will get very sick and have to be in the hospital, and there's not enough hospital beds at this time to deal with that. And so we saw in New York where their hospital system got overwhelmed, and
Right.
they had to send the medical ship there. There are some places in South Texas that are overwhelmed right now, mostly smaller rural areas that don't have the ability to have ICU beds and the qualified staff to staff those beds.
Or even isolate entire wings or floors of their hospital to, like you said, isolate those patients from the general population of sick people who are already there. And that kind of ties into a lot of the deaths with COVID-19, or I would even say, from what I've seen, the majority of deaths with COVID-19 come from people who have underlying conditions.
Correct.
Why is that? Why is COVID-19 not just the main killer of, I don't know, a generally healthy person?
So anybody that has underlying conditions, so you have diabetes, you have obesity, you have a lung problem like COPD, you're more at risk to have an adverse reaction to any illness. And so whenever you have an illness that's worse than other illnesses, so that person may get the common cold and be fine. That person gets pneumonia and they end up going to the hospital. They get the flu and they may be okay, or they may end up getting pneumonia on top of that and then going to the hospital and having a problem. So anybody that's sicker when they get sick is going to be sick.
Makes sense.
Makes sense. Yeah.
That checks out.
Yeah. So herd immunity was one of my favorite things to research for this episode. The opinions on it are pretty vast. And
even in the medical community, there's differing opinions on it.
Because historically, herd immunity is like very important. Like vaccines, everybody talks about herd.
Yeah.
Everybody get vaccines so that you're immune to this disease, because there are people who cannot get the vaccines who are highly at risk for dying from it.
You could make an argument that herd immunity is why we're still alive as a species. That there are plenty of illnesses through the ages that would have wiped us out if herd immunity wasn't possible. With vaccines being the more modern way to kind of fabricate herd immunity in a kind of less natural or organic manner. But yeah, so you have these two sides, and we'll get to vaccines later, I think. But if that's like the second way to achieve herd immunity, the first one would be the quote unquote letting the virus run its course, which I think the people who support this as what should have happened or what should still happen are generally maybe optimistic, maybe too optimistic about the coronavirus, because it assumes that when you develop antibodies that your body is going to keep them, while some studies would say that they fade with time. It also presupposes that, when you develop the antibodies, that means you can't get reinfected, which also we're not sure about, and the science isn't clear on that yet. But so there is one study, I think it was from University of Nottingham. I believe I found it in ScienceDaily.com, that says that sounds legit, right? That the early we're getting a big head shaking now. I found what I could, man. It said that the early suggestion was that 60 to 70% of the population would need to have contracted the virus for us to achieve herd immunity, which is where so many people in the population are immune that the chances are extremely low to almost zero of it really being passed to anyone. But what the studies suggested is that it could actually be closer to 40%. And it seems crazy, but the reasoning is interesting, especially when we're talking about the coronavirus, which, as we just said, has, killed so many people, but mostly those with underlying conditions. Meanwhile, the range of effects it has on people, goes from you're sick for weeks, maybe even months, and your lungs might get scarred, you might have permanent effects, all the way down to completely asymptomatic. You can't even tell that you had it at all. So the mathematical model of this lower percentage for herd immunity comes from the idea that the people most likely to spread the virus or receive the virus are going to fall on the asymptomatic side, or the mild version of it, because we're talking about the people who are out and about, like living life, being generally out in public, acting normally, are going to be the people who are healthier and will be less affected by the virus, or the people who have it and are asymptomatic. And if they have a mild contraction of it, then they're probably going to be spreading a more mild one as well, with just like an added point to that is that some studies show that the virus is already mutating and adapting to human bodies in a way that, while making it more contagious, is also making it less deadly.
That's true.
I think we're going to have to cut it off there and ask, how can people who don't trust the authorities, the official narrative coming from the CDC, who heard Dr. Fauci in March say don't wear a mask and are still following what he said in March and ignoring him in April, where he said, yeah, start wearing cloth masks, and the World Health Organization agreed with him. How can they be friends and have a productive discussion with people who buy into the narrative of the WHO and Dr. Fauci and governing authorities?
I think a key ingredient, especially for like right now in 2020, is kind of agreeing from the start that there's so much we don't know, and that there are literally like peer-reviewed scientific studies out there that contradict one another. And we're talking about a virus that like we just said is like adapting, mutating. Like the things are constantly changing from country to country, from person to person. Like there seems to be decent reason to distrust the authorities. At the same time, authorities are speaking with authority and with information to back them up. And I think we should all kind of try to meet in the middle, say like, we're not wanting to deceive or be deceived. We're trying to be safe and to live our lives and to do that well. And, for some people, like, their idea of safety is getting to live the life they want to live. And for others, their idea of safety is literally physical, just staying healthy and not getting this virus. And I think if we can have that upfront empathy for just what we're wanting out of life and what we're aiming for, realize that these different divisive opinions that we have are for those goals and for those purposes.
Yeah, the acknowledgement at the beginning of the unknown is very helpful for framing the conversation.
Thank you for listening to this month's episode, but the conversation isn't over yet. We want to hear from you. What did we get right or wrong, and what's your perspective on the issue? By writing in, your feedback can be featured in the response episode we will publish later this month. Email us at unlearningignorance@gmail.com, tweet us at unignorancepod, or leave a voicemail at 972-885-9574. Again, that's 972-885-9574. And by lending your voice to the conversation, you can help this podcast represent the Vox Populi, the voice of the people. Thanks for tuning in to Unlearning Ignorance, and we'll be back next month with another divisively divisive issue.